All right, so we're gonna talk about the different oxygen delivery devices we're gonna use with the oxygen tank. So we have the nasal cannula, okay? The nasal cannula is gonna go into the patient's nose, around the ears, and then you're gonna secure it underneath the chin. This is delivered at 1 to 6 liters per minute, and we're gonna use that for conditions such as syncope. Then we also have the simple face mask. That's gonna go around the patient's head and over their face and their mouth, or nose and mouth. This one's gonna be delivered at 6 to 12 liters per minute, and this one can be used for an asthma attack, or when the patient can't breathe through their nose, if they have nasal polyps, or when the nasal cannula can't be tolerated. Sometimes when people put things in their nose, it kind of tickles their nose, and they really can't tolerate that because it causes a lot of sneezing. Then we also have the non-rebreather mask. That's gonna be delivered at 6 to 12 liters per minute. Very similar to the simple face mask in that it fits over the patient's nose and mouth. The only difference is that it has the bag. Before you put this on your patient, you actually have to put the oxygen on, and you have to cover over the little opening there, so that way the bag fills up with oxygen before you can use it. This is 6 to 12 liters per minute, and that's gonna be used on somebody who is having a heart attack. Then next we have the AMBU bag. The AMBU bag is gonna be delivered at 8 to 12 liters per minute. It can be used with the oxygen tank, and that's gonna be used for CPR when a patient is not spontaneously breathing, okay? Now the different parts of the oxygen tank. You have the regulator valve. The regulator valve is gonna open and close the oxygen tank, allowing for oxygen to be delivered. Then you have the pressure gauge. Once you open up the regulator valve, you need to be able to check the pressure gauge and see, I didn't get that tight when we took it off. Now I got it tight. Okay, so you got your regulator valve, you're gonna turn that on, and then you're gonna check your pressure gauge. Now, when you are using the oxygen tank, there are 3 safety features that you wanna make sure you follow. Don't stand over the tank when you're changing this piece off of the oxygen tank. You don't wanna use any petroleum products because they are combustible, and you shouldn't smoke around the oxygen tank, okay? Open up the regulator valve, then you're gonna check your pressure gauge to see how much oxygen is actually in the tank. This one has approximately 1,500 PSI, which stands for pounds per square inch. Once you've done that, you're going to hook up your oxygen delivery device to your spigot, which is right here, okay? So you hook up this to your spigot, and then what you're gonna do is you're gonna adjust your flow meter adjustment knob and watch your gauge to determine how many liters per minute you're gonna be delivering to your patient. Now remember, I have the simple face mask, so this is delivered at 6 to 12 liters per minute. So we're gonna have to turn this up to at least 6 to start. And you can hear the oxygen coming out of the mask. So then you would put this on your patient. Then when you're ready to discontinue use, the first thing you do is take this off of your patient. Then you're going to turn off your flow meter adjustment knob. Then you're going to close your regulator valve. Once you close your regulator valve, you need to bleed your line. How you're gonna do that is by opening up your flow meter adjustment knob until your pressure gauge registers 0. And then once your pressure gauge registers 0, you turn this back down to 0, your flow meter adjustment knob, and then you're gonna remove your oxygen delivery device, which is a one-time use, and then you're gonna toss that and it gets thrown away.